Let's talk about this, though. I mean, the accusation that the White House was essentially making, one that you haven't challenged yet, to my knowledge. Maybe you will here now. Columbia Hospital Corporation, which you founded, which later became HCA, which made you, from my understanding, incredibly wealthy, was charged with defrauding the government for more than a decade and had to pay a record fine of $1.7 billion. I mean, some would argue, and it would be hard to say they're wrong, that you would be the poster child for everything that's wrong with the greed that has hurt our current health care system. People would ask, why should they listen to you?
Well, you don't have to listen to me. You should look at the facts. You should read the bills. Now, if you want to go back and look at Columbia HCA, you should love what we accomplished. One, healthcare costs when I got into the industry in '88 were 16% a year inflation. When I got out in 1997, they're less than 1%. We had the highest patient satisfaction. We had the best outcomes. Now, if you were in the hospital business in the late 80s, you went through Medicare investigations. President Clinton expanded the investigations. They said if you made a mistake in your filing, that was called fraud. Not only did my own company, Columbia HCA,
but $1.7 billion, that's the highest ever paid in the history of the United States that your company ended up having to pay as a result of what you did by defrauding the government.
No one went to jail. I was never accused of anything. Now let's think about it. $1.7 billion sounds like a lot. We had 343 hospitals, 150 surgery centers, over 100,000 patients a day. Now, let's look at the industry. Cleveland Clinic paid big fines. Mayo paid big fines. Yale paid big fines. Now, were they as big? No. But how many hospitals did they have?
But you're the guy who's sitting here telling us that we can't allow the government to do this because it won't work and they might take over or do some things that are wrong. How much more wrong can you be than what you just said? Not only is your company screwed up, and you just admitted to it, but you're saying, and look at all the other companies, they did the same thing.
No, I don't believe that at all.
It doesn't sound to me like a sterling system that we have, does it?
I think that's right. You ought to fix the system. You ought to say, why do we have 135,000 pages of Medicare regulations that people work their tail off? The hospital industry to this day works its tail off to do the right thing. But don't believe me. Read the bill.
You're copying to the fact that your company had to pay $1.7 billion, which is still the most ever paid in the history of the United States, right?
After I left, the company paid those fines. The company did not pay those fines when I was there.
But hold on.
And I bought.
No. You're playing with the facts, sir. Let me tell you what happened. These charges were charged against your company while you were there, while you were the boss, and it happened over a period of 10 years. Yes, they were paid after you left, but they accused them of happening while you were leading the company. You know that.
And Rick, it covered time frames before I bought those companies, and it covered time frames afterwards.
I guess the point I'm making is, though, look, people are going to look at you as the guy who's telling all these people out there, which is your right as an American, and good for them for wanting to get out there and have a point of view and be passionate about their money and their tax money. But some people are going to look at your record and some of the things that you and I just talked about and say, this is the guy who's leading this charge? Is he the one that we should be listening to? Not exactly a perfect past when it comes to what's right for taxpayers and patients.
Absolutely. If you care about